This particular infection you are seeing up here, in most places it is regarded or seen as a spiritual attack or poisoning. But in the real sense, this is not a spiritual poisoning. In fact, this is a bacterial infection. Now, we're going to get into this. But before that, make sure you share this video to a lot of people, because these have created a lot of issues among neighbors. Many people believe that once they get this kind of infection, that means that they have been poisoned by their neighbors and all that. Therefore, having beefs with people who are innocent. Now, let us get into it and let us bust the myth. This is commonly known as Achi Ere in most societies. Some people call it Buruli, some people call it Achi Ere. But the English word for it is Buruli Ulcer. Now, this can happen both in the arms, this can happen in the legs, and if not treated on time, it can lead to having to cut the limbs or the arms, if it gets so bad. Now, let us see why this is not spiritual and why it is just a bacterial infection. I'm going to be reading out from the research that I've made. So firstly, we have to know that the World Health Organization recognizes this infection. Therefore, that is the first step to know that this is not a spiritual stuff. So let us see what it says here. I'm going to be reading from this article that I have right here, which is from these authors, as you can see here. Now, let us see the introduction that they gave. Now, Buruli ulcer, which is BU, is caused by Mycobacterium ulcerans, a chronic indolent necrotizing disease of the skin or soft tissues with high prevalence in rural West Africa. So that is to say that this is mostly seen in West Africa. So, and however, it's the mainly widespread virulent mycobacterial disease of the incompetent hosts after tuberculosis and leprosy. Now, that is to tell you that this is in the same category of tuberculosis and leprosy. So that is to show you how dangerous this particular infection is. The fact that this is a bacteria already clears and already debunks the myth that says that it's spiritual, because if something is a bacterial infection, that means that it can be cured or treated by antibiotics, because anything that has to do with bacterial infection is definitely treated by antibiotics. Now that we understand what Buruli ulcer is, or Achi Ere in other words, the next question to ask is if it has a treatment, and what kind of treatment does it have? Now, the treatment I'm going to be showing you on the screen here, because I'll be reading out as it says. Several antimicrobial agents have in vitro activity, but no single agent has been proven to be regularly useful in treatment of Buruli ulcer. Now, the agents used include rifamycin. The next one is rifabutin. The other one is clarithromycin, azithromycin, ceftriaxone, and amikacin. Now, this I'm reading out is not for you. This is for people that are into the medical field, for in case of prescriptions. This is not for your patients to go and prescribe medications for themselves. So these are for medical experts. When you should also go through this. I think I'm going to show the authors of this book, so that of this articles, so that you can go and read the full articles in case you can learn one or two from there. So this is the treatment, like it says here. And also, combination therapy are mostly used. However, the World Health Organization recommended that all patients with Buruli ulcer lesions should be treated with ceftriaxone 15 mg per body kg, that is, plus rifamycin 10 mg, that is, per body kg, for 8 weeks. So that is to say that according to World Health Organizations, they are clearly recommending to you that this is a treatment that you should just take for 8 weeks. So that is to tell you that this is a bacteria that can be cured in 8 weeks with antibiotics. Now, one might ask, how is this particular infection or bacteria transmitted? How do you get these infections? So let me check. I also made another research with Wikipedia. So let's see the transmission. Now, according to what I have here, it says from Wikipedia, it was not unknown how this Buruli ulcer was introduced to humans, although research in Australia indicates possums as the vector, along with mosquitoes, to be the cause. Buruli ulcer does not spread from one person to the other. Possums are these particular animals that you're seeing here. They are mammals, but I don't think they are popular in West Africa. So I think this is going to be the same thing with our rats, maybe the Nkape version of this. Yeah, those rats that used to have long mouths with teeth. I think this will be the version of it in West Africa. So they mentioned these possums, and they also mentioned mosquitoes. So these two things have been traced to be the causes. Now, they can easily be an agent to transmit this from one person to the other. So do not be surprised when you go back to your village and somehow you get infected with this. It is not always spiritual. So that doesn't necessarily mean that village people are hunting for you. No, that's not what it means. This is not poison. This is a bacterial infection that can be treated with antibiotics. Now, let's go back to the article that I have here by Nigerians. Yeah, I chose these particular articles because they were written by Nigerians. There are a lot of articles on this, but I wanted it to be an African research. So that is why I chose this one. Now, come to think of it, this is a serious bacterial infection, but it gets little or no attention. Yes, it really gets little or no attention because this is at a very high level, but I feel like the reason why it doesn't get much attention is because the widespread is very, very low compared to other kinds of infection. Yes, the spread of it is very, very low. I mean, it's in a very, very few locations where you can contact and contaminate this infection. So I feel like that is why it is getting quite a few low attention, but it deserves a lot of attention because it is very, very deadly and dangerous. Share this video to as much people as you can. Share it to family, share it to friends. You know, someone could be actually infected with this and will actually need to watch this video, and thank you for this. A lot of people use this to scam people by telling them that it's a spiritual stuff, and then they'll start taking money from you to try and cure it spiritually, or they'll start prayer and fasting will not cure this. This is a bacterial infection. Doing prayer and fasting is not going to cure it. Going to the Babalawo house is not going to cure it. At the end of the day, even if they manage to cure it, then that means that the person already have the knowledge that this is a bacterial infection. And at the end of the day, they're going to give you an antibiotic. There are also antibacterials and antibiotics that you can get locally. But make sure that you go through a prescribed way. Go to your doctors. Find doctors that know much about this particular ulcer. Share this to as much people as we can and educate people and enlighten people about this ulcer. This is not poison. This is simply a bacterial infection, and it can be cured with antibiotics. So do with this information what you wish. Follow me for more health and client videos like this one. I'll see you on the next one, guys.